Hey everyone, thanks for being with us today, and thank you for choosing to be a host for ShareWell. My name's Ted Morris, and I'm one of the hosts here at ShareWell. I was a therapist in community mental health for 15 years, and I specialized in working in crisis therapy and with convicted sex offenders. I've had a chance to work with a wide variety of people, and one thing I learned is that people only want to be met where they are in this moment and to be listened to. This is particularly true if they're experiencing a crisis and have been considering self-harm. Now, many people considering self-harm never discuss it directly because of the shame, embarrassment, and cultural fear we have around this topic. Now, this is exactly why we should talk about it. Now, while it may seem extremely awkward and more than a little scary to talk about, the person considering self-harm feels that even more intensely. We want to talk about it out loud in a supportive manner so the person experiencing it knows they can speak about it safely with their fellow group members in a non-judgmental environment. Risk of suicide is a concern for people with mental health conditions. As a facilitator, you should be prepared in how you handle the situation should someone mention they're thinking about harming themselves. The goal is always encourage someone to get help, as it is the first step towards safety. Although it is not a common occurrence here on ShareWell, any mention of suicide should always be taken seriously. Most people who attempt suicide have given some warning, and a lack of acknowledgement of this warning can reinforce the belief that no one cares. Now, in this lesson, you'll learn how to best support a participant on the rare occasion that they mention suicide or self-harm. If you notice any of the warning signs or you're concerned someone is thinking about suicide, don't be afraid to bring it up in your support group. Start the conversation. Open the conversation by sharing specific things they have said or signs you've noticed, like, I heard you say now that your children are gone, you feel like you don't have any reason to continue anymore. Or, I hear that you're feeling like you hit rock bottom again. And the last time you were there, you contemplated suicide. Then ask direct questions like, are you thinking about suicide or harming yourself? Do you have a detailed plan? When was the last time you thought about suicide or harming yourself? If their answer is yes to any of the questions above, or their response is immediate, you'll want to encourage them to seek help immediately. Ask if they can call a therapist, psychiatrist, physician, or any other healthcare professional who's been working with them. Here's some examples of things you can say. You are not alone. I know it's tough, and I'm here for you. I'm concerned about you, and I want you to know there is help available to get you through this. I may not be able to understand exactly how you feel, but I care about you, and I want to help. I don't have the mental health background to support you in this, but I care that you're here, as does everyone else in this crew. I want to encourage you to reach out to someone who can help. I don't know how to best support you in this, and I don't feel qualified, but I do care about you, and I know of some resources that might help.
Sometimes I just wonder what it's like I just think about how great it would be if I were to fall asleep and just not wake up again. Be nice.
Do you think about that often?
Um, yeah, no, I mean, it's a long story.
Say, in a weekly basis, how often do you think about that in a week?
A couple of times a week.
Okay.
Probably like maybe half the days.
Does it increase more? Does it decrease more according to, say, either your stress level, time of year, anything like that?
Yeah, I mean, it comes and goes, right? Like it's cyclical. Some days I feel great, and I go through a time where things aren't great again. Things are pretty bleak. So, yeah, it's definitely cyclical. And I mean, I know my depression has gotten worse in the last couple of weeks, so it's not surprising that I'm thinking about it more.
Okay.
Yeah.
So it sounds like you're quite well informed and you got a lot of insight on your own cycles and behaviors. That is really fantastic to see. 'Cause frankly, most people, a lot of the time, they're mysteries to themselves, and they don't know why they're doing this, that, or the other. You, however, it sounds like you have a pretty good handle on it. And I
I've
also,
been living with it for a while, so
right, and I also appreciate you bringing it up here in a group with people who can help you. I mean, that tells me that you did feel safe enough to bring it up in the first place, which is a big deal.
well, thanks
Not,
for listening.
of course. And I know I can tell you're not comfortable talking about it, but again, I appreciate it. And I think you should recognize how much courage that took on your part. Now, we see the nodding head, so the rest of the group is in full support of you here. And they're recognizing how much courage that took as well.
Well, I'm grateful for everyone for listening, and I'm sorry for taking so much airtime on this.
Nothing to apologize for. That is exactly why we're here. Again, I appreciate you bringing it up. If you're okay with it, I would like to pass on some resources to you in the chat after we're done with our group. That be okay?
Sure. What kind of resources? You know, when I was a kid, I used to go down to the pool and like I'd wrap my arms and legs around the bottom of the rung and and just kind of wait to see if I would drown. Obviously, I never did. But I actually remember it feeling really good for some weird reason. And I know it sounds weird to say it, and it's probably wrong to think it feels good, but like, yeah, it was actually kind of a relief sometimes to sort of pretend that it would just be gone for a bit.
Do you think about that currently?
No, I mean, honestly, like, I mean, I realize now for lots of reasons why that never worked for drowning myself. But I think I missed a pool still, and I like missed a feeling of being in water, but it's not. Yeah, it's not something I like think about in that same sense.
Okay, so you're not actively thinking about harming yourself in any way.
No.
Okay, I'm not trying to put you on the spot, but I do have to ask. Now, and this goes for everyone here, not just Angela, we do have resources available if you need anyone to talk to. Now, they're on our website. The link is on our website, and there is a great number of resources there for a great variety of issues. So if you guys ever need it, it will always be there for you. And that's just a good handy thing to know about ShareWell. When faced with someone who may be at risk of suicide, it's important to validate the person's feelings with empathy, stay calm, and normalize the conversation. Ask questions to assess the immediacy of the situation to help determine where to start and what resources to direct them to. An example of this question could look like, it's okay to bring this feeling up, and I want to make sure you're okay. Are you currently harming yourself? A person experiencing a mental health crisis can't always clearly communicate their thoughts, feelings, needs, or emotions. They may also find it difficult to understand what others are saying. So encourage participants to pursue outside assistance and resources. Report such community members to ShareWell so we can further assist in ensuring their health and safety.